Welcome to another Public Health Minute with Chloe Stallion, and today we are going to be talking about epicurves. Considering we're in a global pandemic and epicurves are used a lot right now for tracking the coronavirus spread across the globe, I think it's fitting that we should learn a little bit about it. Epicurves are a visual display of an illness during an associated outbreak, and it shows the frequency of new cases over a period of time. Epicurves allow epidemiologists to track how fast a disease is moving through a given population or populations. Components of an epicurve are time along the bottom x-axis and bars traveling up the y-axis, increasing with the number of cases that are seen each day. So there are three different types of epicurves that are shown based on the disease and its mode of transmission. So the first is point source outbreak. These types of curves are often caused by a common source where exposure is seen over a short period of time. So you see a long peak and then a fall. An example of point source outbreak would be contaminated food source. There's also a continuous common source outbreak curve which shows rapid peaks and falls. Not all the cases arrive from the same incubation period. An example of that would be a contaminated water source. Lastly, we have propagated epicurves, which are usually person-to-person transmission of a disease with a single index case that spreads throughout a population by spreading to individuals. An example of a type of curve like that would be measles or our current situation, COVID-19. There are a lot of information we can get about a disease from an epicurve, such as the mode of spread, so that was the three that I listed before, the likely period of exposure, the start time of the epidemic. It also predicts future outbreaks, an outbreak time trend, outliers, and magnitude. I decided to throw in an epicurve that shows the current trends we are seeing with COVID-19. Well, that's it for today. I hope you guys are staying safe and healthy at a time like this, and I'll see you next time for a Public Health Minute.